There has been a lot in the news about the weight loss drug Ozempic. And, suddenly we are seeing a lot of people in Hollywood who are losing weight. And I've been hearing some rumors that there are very serious side effects, especially concerning the gut, but I don't know if it's true. And then this week, there were some very big headlines about the benefits of the drug, which is semaglutide, which is in Ozempic. And it is saying that if you take it, and even if you don't lose weight, it reduces your risk of heart attack and stroke. Now, call me cynical, but my BS radar went straight up. So I have invited cardiologist Dr. Aseem Malhotra to come and talk about this and tell us what he makes of all this. Hi, Aseem.
Hi, Glynis.
It's absolutely wonderful to see you again. It's been a while since you've been on Ageless.
Likewise, always nice to see you.
So, Aseem, well, you're a cardiologist. So first and foremost, the two things I would like to talk about, as I said, this headline that it helps prevent heart attacks and strokes, and also about the possible side effects of semaglutide, which, as we know, is in Ozempic and also Wegovy, and is one of the hottest topics in the world right now because everybody seems to be on it. So as a cardiologist, what did you make of the headlines this week?
Well, my job, Glynis, first and foremost, which should be the job of every doctor, is to improve patient outcomes. So that means managing risks, treating illness, reducing suffering. So the question is, and of course, to do that, we have to have reliable information to make decisions on whether it's a drug treatment or a surgical treatment or even a lifestyle intervention. So for me, the first thing is, did the actual data behind the headlines, did they match? And before I break that down for you, Glynis, I think one thing that's really important that most people still haven't fully grasped, and actually most doctors don't know, which is a bit scary, is that almost without exception, all drug industry sponsored drug trials, okay, which this was, all industry sponsored trials, the data on which they make their conclusions is never independently verified. So what does that mean? You're a drug company whose primary interest is profit. If you do some good as well, great, but that's not the primary motive. The primary motive is to make profit. When they conduct these trials, they design the trial. So that means they are likely to design the trial that's going to give their drug the best possibility of outcome, of positive benefit, to show positive benefit, which often means that they will actually select patients in the trial that they think are not likely to get side effects because they've done these pre-trial experiments. They've kind of figured out, okay, who might be more likely to get side effects. So they tend to exclude those. People don't know all this stuff. So there's huge bias there. And then they do their own analysis of the results. And then what they do is, often these trials that involves tens of thousands of people, the actual data that's collected in the trials is thousands and thousands of pages long. On every single patient, they're almost following them up regularly every day. Are they getting side effects? Are they not, etc. Asking them questions. That information is rarely independently analyzed, okay? And they actually then do their own analysis, produce conclusions, and then they give summary reports to regulators that we think are independent, but they're not because they get most of their funding from pharma, who then make a decision about whether the drug is approved. Often they will publish their results in so-called high-impact, reputable medical journals. In this case, the New England Journal of Medicine, which is considered the highest impact medical journal in the world, which means it has the most influence over doctors. But that medical journal takes often millions from the drug industry. So there's a financial conflict. So there are so many biases, Glynis, that the bottom line is the results that were, which I'm going to tell you anyway and break them down, are likely not even true. And that's really important.
Aseem, can you explain to me how, in the medical profession, that is a legal process? It defies belief. And I am aware of this.
Yeah.
I am aware of this. And I think, as you say, I think a lot of people aren't aware of it. And
Yeah.
in what other industry would you get away with that?
I can't think of any, Glynis, to be honest. And it's a failure of the regulatory process. It's a reflection of the corporate capitalist system, which really has given these big companies power that they've never had before. And that means they've got generated so much money over the years, often from fraud, right? That they now can lobby politicians, they can influence regulators, and they're able to get away with it. And the system, unless that changes, we're never going to improve people's health because, as you know anyway, and we'll talk about it regarding the drug, what determines people's health mostly does not come out of a medicine bottle. So, you know, and pills really have a very marginal effect, certainly when it comes to managing chronic disease, which is a major issue of our times. I don't want to throw the baby out with the bathwater. I think there are a lot of great things we do in medicine, but a lot of those low-hanging fruit, great things we do in medicine, whether it's about discovery of antibiotics for treating infections, whether it's acute treatment of heart attacks from emergency stents, whether it's the development of defibrillators, whether it's insulin for type 1 diabetes, people would die without that, whether it's dialysis for kidney failure, or whether it's a couple of different very useful screening techniques we use. Colorectal cancer screening is very useful, and cervical cancer screening. Most of the other screening is essentially not very good. So there is definitely a lot of great things we do in acute care, but most of what we do now, I would say, a lot of, if not most of what we do in modern medicine, actually not only doesn't give any benefit to the patient, can cause adverse effects, but simultaneously, deliberately, because of the corporate capitalist model, suppresses information, Glynis, around other healing arts that don't involve modern medicine, whether it's, whether it's lifestyle changes, whether it's dietary changes, whether it's certain supplements, whether it's even herbal medicine, whether it's Ayurveda. Part of this model has survived by deliberately suppressing alternatives that are likely to be more beneficial for you, do not come with side effects, and increase the quality of your life. And that's something these pills cannot, by and large, do. Whatever they may do in a marginal effect down the line, whether it's preventing a heart attack, they rarely can improve the quality of life. If anything, they decrease the quality of your life. So the whole system is not actually working for the benefit of the patients. And one of the other reasons, the medical profession involved in this, well, I think the medical profession, most of the doctors are genuinely caring. They want to do the best for patients. They're intelligent, they're hardworking. But they are trusting information that's given to them from these medical journals and from guideline bodies as being independent and the best information we have, when usually it's the complete opposite. So their lack of awareness of these system failures perpetuates the problem, Glynis.
It does. And I've witnessed that myself. I have been shocked sometimes and the lack of awareness of certain doctors that I've spoken to. And
Yeah.
I think especially in the last few years, everything that we as a global society have been through, where health has become so important and so precious and so vulnerable because of everything that's coming at us. The wellness industry and people taking charge of their own health has really gained a huge momentum. And a lot of those people will be watching this video because people now realize that you have to take care of yourself. And it's not just, as you say, medication plays a very important part. Modern medicine plays a very important part. But there are other natural things that also play a very important part. And it's good to know about them. So, Aseem, let's get back to this particular issue about semaglutide.
Yes. So I've got the paper here. And I will read out the results to you so people can, and then I can explain what that means. Okay. So they involved 17,000 patients were enrolled, right? They're in two groups. So you give 8,000, roughly 8,000 were assigned to receive semaglutide, also known as Ozempic or Wegovy, all right? And 8,000 to receive the placebo, the dummy pill. Sorry, it was an injection, weekly injection. And in these situations, when a study is conducted to give it the highest likelihood of being reliable in terms of the quality of the data and the results, it's called double-blinded. So the people receiving the injection don't know whether they're getting a dummy injection, say saline, or they're getting the actual drug. And the people administering it don't know either. So it's all collected. There are certain codes that are given. So it goes into a computer to remove any bias whatsoever. Okay, but that's again a bit. But that doesn't take into account the design of the trial, who's interpreting the results, how they present it to the media, etc. Right, and then of course the raw data not being looked at. So this is what they do in the trial, and then they followed these people up for at least 34.2 months plus or minus 13 points. So it's about 4 years. Okay, so they followed them for about 4 years. And then they measured in the people that received Wegovy, how many people suffered a heart attack, stroke, or death. And they compared that to the people who did not receive Wegovy. And out of 8,000 people treated in one group that received Wegovy, there were 569 patients who suffered a heart attack, stroke, or death. Whereas in the 8,000 people that had the dummy injection, 701 suffered a. So to break it down, it was 6.5% of people suffered a heart attack, stroke, or death who took Wegovy versus 8% of people who were in the. So the difference was 1.5%. So the benefit in absolute terms for an individual was 1.5%. Another way of breaking that down is a 1 in 66 chance. That means you have to treat 66 people for one of them to benefit from preventing a heart attack, stroke, or death over 4 years. Now, that isn't in the headlines, of course. What they do is they use a relative risk reduction. So they say they are 20% less likely, but actually that doesn't take into account what we call your baseline risk is. All these people already had a heart attack, or stroke, and death in the background. But so those figures probably for a lot of people hearing this now, Glynis, will probably be a bit like, oh, that doesn't sound that great. I mean,
no,
I don't know. I mean, the way I approach it with patients is I will break down the numbers for them and ask them and help them to make an informed decision. I will not try and coerce them. They might say, Doc, I'm not sure. What do you think? And I'll give them my opinion. But the way to practice ethical evidence-based medicine, and this isn't just my opinion, this is something that in fact was recommended by the medical Royal Colleges, because I worked with them as an ambassador for many years. In 2015 in the BMJ said that all doctors should be doing this as an ethical imperative, but it was never introduced into as a mandatory way within clinical practice, partly because these things take time, but also partly because there was a big barrier. There's a backlash towards me in all of this behind the scenes, and that's another story. Is of course when people are given the information and when people are fully informed, they tend to take less pills, and of course that's where the drug industry is going to lose out on money. This is just how corrupt the system is, Glynis, unfortunately. But just to break it down, that was the benefit. Okay, again, in non-transparent data, so it's likely still an exaggerated benefit, right? So I'm saying that this is
slight. Just sorry, in layman's terms here. So it's a very slight benefit. There's a benefit, but it's very slight. But then, as you said earlier, we have to take into account that they would have cherry-picked the people that they used.
Absolutely, most likely. And again, we can't be sure if this is true until you've seen until the raw data has been independently analyzed. And none of the guideline bodies, the peer reviews of medical journals, the regulators even haven't even seen the raw data. Can you believe that?
I actually can't believe that. And you would think that they would want to get it independently verified to just, to make themselves look better. And it does beg the question is why wouldn't they do that?
Well, I think over time, it's a very subtle influence, which I would call tyrannical, of the drug industry, is that the people they employ to those positions to be regulators are the people who are friendly to industry and want to please their industry masters. And therefore, those are the ones that are in the roles of being in charge of the regulator. They're the regulatory bodies. Does that make sense?
Yes.
And then people who speak out, Glynis, and people have over the years, and that's why stuff has got out there. And people like Peter Gersher, who's one of the co-founders of the Independent Cochrane Collaboration, which has now unfortunately become influenced by industry as well. He wrote a book. People want to look at just how bad it is as an insider. It's called Deadly Medicines and Organized Crime. That's what he calls his book.
Wow.
And he's one of the most eminent independent researchers in the world. So that tells you everything you need to know. So if I was having a conversation with a patient, right, one of the things that's important, I believe, I am an advocate for something called shared decision making. Sounds very controversial, Glynis. How do you give patients and reach that, speak to them from a position of respecting their preferences and values, to give them information the way they can understand, free from coercion, to make a decision for them, which is in terms of what they want. That's called shared decision making. Part of shared decision making is also expressing to the patient uncertainties about the evidence. It's actually really important. Most doctors don't do that.
Yeah.
So what I tell patients is what I'm telling you. If we take this as gospel truth, which I don't think it is, right? Because it's industry sponsored and it hasn't been independent. This is the best case scenario for you. 1 in 66, and side effects. You asked about side effects.
Right.
Interestingly, in this,
the side effects, please.
yes.
Yes.
So the side effects they found was roughly, in comparison to the placebo group, an excess of 8%. So about 1 in 12.
Wow.
Right? That resulted in discontinuation of the drug. And what they cite, and they haven't gone into, this is why you need the raw data. They make it very generic: stomach issues, nausea, vomiting, that kind of thing. But we know there have been case reports separately, and I'm sure you know of people, and I know of doctors who've been using this, of actual permanent stomach paralysis. Now, I'm not saying that's 1 in 12. I think it's probably much less than that, of course. But it is probably one of the side effects of the drug, which is, again, we don't have
paralysis. I don't understand.
Well, it causes a stomach, so you get bowel obstruction. The actual bowel, that obviously something called peristalsis, which is how when you eat food, to move the food and to absorb nutrients and to get rid of waste products in your when you go to the toilet, right? To put it in more medical terms, defecate. You need your bowel, your colon, your stomach to be moving, right? To push that food through, to push those contents through. So that's when it actually stops working. Complete paralysis is called bowel obstruction. So these are things I've heard. Now, I can't give you a figure, and I'm hoping it's quite rare, but of course it's a possibility. So this is the approach. This is what the drug, these are the benefits of the drug, again at best, which again are lightly exaggerated. But of course, part of practicing proper medicine is also part of shared decision making, right? And part of what the medical Royal Colleges have said. So this is So this isn't just my opinion, Glynis. This is something that I was part of and is published in the British Medical Journal, actually recommended by the Academy of Medical Royal Colleges, which is the organization, the body that represents every doctor in the UK. They recommended that that patients should be encouraged to ask, when it comes to any intervention, do I really need this test or procedure? What are the risks? And of course, the benefits need to be given in absolute terms, as I've said. Are there simpler, safer options, and what happens if I do nothing? So the question about simpler, safer options is also about alternatives. And of course, that decision-making process with patients, it will not be complete unless you talk about the alternatives. And of course, that's where lifestyle interventions come in, right? Which, okay, if I'm playing devil's advocate, people come back to me and say, well, see, most patients want to take a pill rather than do a lifestyle change. I don't think that's true. When patients are fully informed, actually, most of them choose to do the lifestyle, I can guarantee you. But they're not being fully informed.
I mean, look, one can say, obviously, if you are overweight, especially if you're seriously overweight, there are huge benefits in losing that weight. And, we're talking diabetes and inflammation. Yes. But I do think it's very important how you lose that weight, because if you lose that weight through healthy living, you are going to be benefiting your health in so many ways. But if you just lose weight, especially if you lose weight quickly, my concern would be that you're losing a lot of your muscle mass, as which can happen with any kind of weight loss if you lose it quickly, because you don't want to lose muscle, you want to lose fat.
Yes, I mean, you're going to lose some muscle anyway, I think, with weight loss generally, because it's very difficult to not lose a bit of muscle. But you're right, you don't want this to be a disproportionate amount of muscle loss. And I think the other thing to mention, Glynis, is as well, weight loss per se on its own there's never been any actually good data when they've looked at people long term in terms of it. I'm saying weight loss for the sake of weight loss alone, right?
Yeah. Has
not shown to improve outcomes. That means preventing the very conditions we worry about with obesity, heart attack, stroke, etc. So the way you lose weight is more important than losing weight per se. And of course, for me, the primary way, or the best way, the most important healthy way, is really primarily dietary changes. Exercise is important for health, but actually has no benefit, almost no link with weight loss. But of course, I just tell my patients, if you can just move, do a brisk walk every day, that's good for you anyway, separate to the weight loss. But the most important way to lose weight in a healthy way is dietary changes, where you're introducing foods or making swaps that are going to be good for every aspect of your health, regardless of the weight loss. So for your mental health, for your gut microbiome, for prevention of heart disease, for reducing risk of cancer, this is exactly the way we should be focusing. But the reason that isn't at the forefront of the management of most of these issues is because there's no real market for that. You can't commodify a healthy diet. You can't commodify eating. When have you seen adverts recently for people eating apples, for example, or having
No,
7 to 10
I
portions
mean,
of
look,
whole fruit and vegetables a day? There's no single entity that's profiting from it. There's no
there's
corporate
no
entity
money to
that's
be
profiting.
made. There's no money to be
No.
made. So
There is for the individual because you're saving money yourself, but no money to be made by an industry.
yeah, exactly. And I'm sure, and it can be very hard losing weight, and it is very frustrating for people because they do go on a diet or they do try and make changes, and yet they're not getting the weight loss always that they want.
It's on that. Yeah.
Yeah.
Sorry to interrupt you. On that note, you're absolutely right. So let's just expand that out a little bit.
Yeah.
I think first of all, it's much easier to prevent disease than it is to reverse it. Okay, so the prevention stuff has to be there. I think there's also an issue around our culture, and a lot of people do things to their bodies because of a culture that overemphasizes appearance. Okay,
Yeah.
and I think that isn't good as well. That applies to all sorts of the things that we do. So I think we've got to think about mental health as well when it comes to how we manage these patients. And of course, I'm not saying that these drugs may not have a role when people have exhausted other things or it's not having, but as long as they know exactly what the benefits are and what the side effects are, that's fine. And of course, in extreme cases, I don't think this is widespread, definitely in certain people, bariatric surgery for people who are very significantly overweight with, morbidly obese and they're struggling, I think that can definitely have a beneficial role to play. But people need to be given all the information in a transparent way, free from coercion, so they can make informed decisions.
Absolutely. And I mean, I was just going to say, I mean, you can see why it is very tempting to say, all you have to do is take this pill. But I think what people don't realize is the reason you lose weight is when you take that pill, it makes you feel so sick, you don't want to eat. I mean, that's what
it affects
I
appetite.
don't know.
Yeah.
There must be some people, you lose your appetite because you feel ill. I mean, I had a friend on it and she felt so ill she couldn't eat. But to me, that's not a great way to live.
Absolutely.
But I mean, I trust me, there have been times in my life where I thought, if only it was just a little pill I could take, So you can see why it's very tempting. But as you say, if somebody, has, is morbidly obese and has health problems, you can see, and there are also other things. I mean, metformin is taken for that as well, because that will stop your appetite as well. So I have known people who have lost weight on metformin, but the one thing I did notice with that, which is the drug that they give to diabetics, and I think it does suppress your appetite. And I mean, I've heard people say a lot of good things about metformin. I don't know. But what I have noticed with people who've lost weight on metformin, for example, is that the minute they stop taking it, they seem to put it all on and possibly more. And I don't know why that would be. But I don't know if you have any thoughts on that.
Yeah, I'm not sure what that is. I mean, I think the metformin is generally a safe drug. I've used it countless patients, certainly with type 2 diabetes.
Yeah.
But again, I think there's a little bit of an overzealous approach to metformin with a lot of the sort of people involved in the health space where they think it has these dramatic, amazing other benefits in terms of longevity, etc. It may well do. I just don't think we've got any good quality data. We've not got any good quality data to tell us that.
But that's interesting because I'd heard that metformin is linked to longevity. But wouldn't that be more about having stable blood sugar levels, being weight, more than the metformin itself?
Absolutely. And I think, Glynis, there's another point to be raised here as well, is these pills should not give you the illusion of protection. Let's say, so for example, we've talked about statins before, right? This blockbuster, they compared this new Wegovy saying it's the greatest breakthrough since statins. I mean, statins, to be honest, have been, in a population level, I'm not saying they don't have a role, on a population level, they've been pretty rubbish. But, patients are not told, most people taking statins at best will get a 1 in 100 benefit, 1% benefit over 5 years in preventing a heart attack or stroke. At best, again, non-transparent data. I've called for public inquiries into statins before the pandemic. along with a lot of other eminent doctors and medical journal editors. But what happens with some patients that I've seen is they think they take the statin, their cholesterol goes low, they can eat what they like. And that can actually have a negative effect to the extent where the harms from the illusion of protection of statins are far greater than the benefits of statins. So think about that. The net effect on that patient is actually negative. By giving them statin, thinking it's the be all and end all, and they basically go and think they can eat McDonald's and have Coca-Cola and become insulin resistant over time. But it's okay. I've got type 2 diabetes, I've got high blood pressure, but my cholesterol is low.
And it's so true. It's just, you know, not putting any thought into your health and just thinking of medication. It's a little bit like putting sunblock on at the middle of the day and think, I'm fine, and going lying in the middle of a desert all day thinking, but I'm fine, I've got sunblock on, and thinking
Yeah,
that.
and Glynis, I mean, if it wasn't so serious, it would be a comedy sketch.
Yeah, yeah. Well, and listen, thank you so much for putting it into perspective, and I think for highlighting, you know, because there are so many. I've covered a few. I've covered a few headlines actually with Dr. Zoe Harcombe recently. There have been some humdinger headlines, you know, coming out of places like Harvard. And, you know, she looks at it and what's really going on.
Yeah, I'm sorry to say Harvard, a lot of good people in there. In fact, one of the people in the documentary, John Abrams from Harvard. But like a lot of these institutions, Glynis, they have been massively corrupted by the drug industry. So Oxford, Harvard, they're probably some of the most corrupt medical institutions in the world. And in my documentary, we're going to expose all of this.
Wow. Well, I can't wait to see it. What's it going to be called?
It's First Do No Farm with a PHARM. First Do No Farm.
Very appropriate. Love it. Okay, Aseem, well, thank you so much. And hopefully we'll see you again soon.
Lots of love.